The story of the Spanish flu pandemic begins far from Spain, most likely on the wind-swept plains of Kansas in March of 1918. In Haskell County and at Fort Riley, a massive U.S. Army training camp, a new strain of influenza emerged among soldiers preparing to head to Europe. Initially, it seemed almost ordinary. A sore throat, fever, chills, and body aches. Within a week, over 500 men at Fort Riley were ill, but this first wave was surprisingly mild and most recovered quickly. For the first half of 1918, the flu did not appear significantly more dangerous than a typical seasonal influenza, yet the timing was perfect for the virus to spread. Crowded transport ships carried tens of thousands of soldiers across the Atlantic to Europe, turning military vessels and trenches into incubators. Once the virus reached the battlefields, it spread with unprecedented speed, infecting roughly 900,000 German troops and crippling French and British forces, while military planners struggled to maintain operational strength. Governments kept news of the disease largely secret, fearing that public panic would undermine morale. Meanwhile, Spain, which remained neutral in World War I, reported openly on the outbreak in its cities. Newspapers in Madrid, Barcelona, and other towns chronicled the illness and rising death toll, leading international readers to mistakenly believe the flu had originated there. That perception gave the pandemic its lasting name, the Spanish flu. By the summer of 1918, the initial wave seemed to subside, lulling the world into a false sense of security. Yet the virus was mutating quietly, adapting to infect more efficiently and become deadlier. This first wave, mild as it seemed, set the stage for the second, far more lethal wave that would erupt in the fall and transform a global influenza outbreak into one of the deadliest pandemics in recorded history. By the fall of 1918, the virus returned far deadlier than the first wave. This second wave had mutated into a highly virulent strain, capable of killing even the healthiest adults between the ages of 20 and 40. Unlike normal influenza, which mainly threatens the very young and the elderly, this strain triggered extreme immune responses in strong bodies, causing what modern scientists now identify as a cytokine storm. Infected individuals often developed severe pneumonia within days, and their lungs would fill with fluid, leaving them gasping for oxygen. The symptoms were gruesome and fast-acting. Victims developed dark, mahogany-colored patches on their skin as their bodies suffocated, while coughing fits could produce blood-tinged mucus. Hospitals quickly became overwhelmed, unable to keep pace with the sudden surge of cases. By October of 1918, the United States experienced its deadliest month in history, with an estimated 195,000 deaths. Life expectancy across the nation dropped nearly 12 years, an unprecedented collapse in public health. Cities reacted in very different ways with strikingly different results. Philadelphia, ignoring warnings, held a massive parade to sell war bonds, drawing hundreds of thousands of people into close quarters. Within days, every hospital bed in the city was full, and thousands perished in the weeks that followed, with nearly 13,000 deaths recorded. Meanwhile, St. Louis implemented early and strict measures. Schools, theaters, and public gatherings were closed, and masks became mandatory in public. The city's death rate was just 1/8 of Philadelphia's, demonstrating that social distancing and quarantine, though primitive by today's standards, were highly effective. Without vaccines or antiviral treatments, the world had few tools to fight the disease. Pneumonia and other secondary infections claimed countless additional lives. The second wave would ultimately leave tens of millions dead worldwide, showing the terrifying power of a rapidly mutating virus in a globally connected population. This wave transformed the Spanish flu from a regional epidemic into a full-blown pandemic, one that would leave scars on nearly every continent. The second wave of the Spanish flu did not remain confined to Europe or North America. It spread across the globe with terrifying speed. Troop movements, international shipping, and expanding railway networks acted as highways for the virus, carrying it to every inhabited continent. Remote regions that had little contact with outsiders were not spared. In Alaska, entire indigenous villages were devastated, leaving children orphaned, and communities fractured. In parts of the Arctic and Pacific Islands, mortality rates reached catastrophic levels because populations had little prior exposure to influenza. India was particularly hard hit. Estimates suggest that at least 12 million people died there, representing roughly 5% of the country's population at the time. Urban centers across Europe and the United States struggled to cope with the sheer scale of the outbreak. In New York City, approximately 33,000 people died, while hospitals, morgues, and funeral homes were stretched beyond capacity. The total death toll in the United States eventually reached around 675,000. Globally, the death toll was staggering. Most historians agree that at least 50 million people died worldwide, with some estimates rising as high as 100 million. To put that in perspective, World War I, which had lasted 4 years and involved dozens of countries, had claimed roughly 20 million lives. The pandemic moved faster than any war, killing more people in a single year than the Great War did in 4. Hospitals were completely overwhelmed, with shortages of doctors, nurses, and medical supplies. Makeshift wards and temporary hospitals were established in schools, churches, and other public buildings. Mass graves were dug in cities around the world to manage the sheer volume of corpses. In many places, the sound of carts transporting the dead became a normal part of daily life. A grim reminder that this was not a distant battle, but a war waged inside homes and neighborhoods everywhere. After the devastating peak of the fall of 1918, the Spanish flu did not disappear immediately. A third wave struck in the winter and spring of 1919, less deadly than the second, but still claiming countless lives worldwide. Communities already weakened by previous infections saw renewed outbreaks, particularly in Europe and Asia, where healthcare systems were exhausted and malnutrition was widespread. In some regions, mortality remained high because hospitals and clinics were still overwhelmed, and public health resources were scarce. By 1920, a fourth, weaker wave flickered in certain areas, including parts of Europe and Africa. This wave largely affected children and those who had not been exposed in previous waves, but it marked the final major spread of the pandemic. Across all waves, it is estimated that at least 1/3 of the global population, around 500 million people, were infected. The pandemic left a profound impact on societies, economies, and public health systems, with some regions taking years to recover fully. Despite the staggering scale, the Spanish flu largely faded from public memory for decades. Unlike World War I, which had defined heroes, clear battles, and a visible enemy, the flu was invisible and indiscriminate. Ordinary people suffered in private homes, and many survivors carried trauma too personal to share. Monuments and commemorations were rare, and newspapers quickly shifted focus to post-war recovery and the celebrations of the Roaring '20s. It wasn't until much later, with modern scientific study and the reconstruction of the virus in laboratories in the early 21st century, that the true scale and lethality of the pandemic were fully understood. Researchers recognized it as one of the deadliest events in human history, a stark lesson in how rapidly a novel pathogen can spread across a connected world. The Spanish flu left societies grappling with grief, lost populations, and the realization that even in the modern era, humanity could be vulnerable to nature's microscopic forces. By the end of the pandemic, the world had been brought to its knees. Estimates suggest that at least 50 million people died, and some figures indicate the toll may have reached 100 million. Cities, villages, and rural communities alike had been devastated, and the societal impact was profound. Entire families were wiped out, leaving children orphaned and economies struggling to recover from both the war and the disease. The Spanish flu highlighted the fragility of public health systems at a time when vaccines, antibiotics, and advanced medical care were unavailable. It demonstrated how quickly a virus could travel across continents in an increasingly interconnected world. Cities that responded quickly with social distancing, isolation of the sick, and closures of public spaces experienced dramatically lower mortality rates, showing the critical importance of proactive public health measures. Despite its global impact, the pandemic was largely forgotten for decades, overshadowed by World War I and the subsequent political and economic upheavals. Survivors carried immense grief, and communities struggled to process the trauma of losing a significant portion of their populations in such a short period. Yet the event left a lasting scientific legacy. It fueled research in virology, epidemiology, and immunology, leading to better understanding of influenza and more preparedness for future pandemics. The story of the Spanish flu serves as a chilling reminder of nature's power and the vulnerability of humanity. It killed more people in a single year than the Black Death killed in 4, yet it also taught vital lessons about prevention, preparedness, and the importance of global cooperation in public health. 100 years later, the pandemic continues to inform how societies respond to emerging viruses and how history can guide us in protecting millions of lives.